involution of the uterus.
So is there a right position? How should they lift? What should they do? Your pregnancy hair, have you seen? It feels lush
Yes.
and dark and beautiful and shining.
Is the normal phenomenon.
As it is, the body goes through a lot of stress during pregnancy. Post-pregnancy. What is the care a lady should take for the uterus to kind of get back to its original size, or rather tension in the tissue? How does it kind of get back? What about lifting? The baby itself is lifting weight, right? So is there a right position? How should they lift? What should they do?
So I think involution of the uterus, or the uterus basically going back to the pelvis, is the normal phenomenon, which is going to happen in the next 40 days if everything goes well. What you have to do is good sleep, which is, I know, extremely difficult with a young baby. So capitalize whenever your baby is napping, you nap. Good diet, a rich diet in protein. In India, we have so many myths about what can a pregnant, there's so many times the patient is going to come in and say, I've been told not to have anything that has spice or anything that is rich in protein because, the baby is going to get gut issues. The baby is going to get colic no matter what you do. That's the baby's job. So you have to keep your diet rich, because like you will be able to emphasize better that the hair is going to go through its now own phase where postpartum hair fall is as it is going to happen. You have to pull up the iron game, because now your baby is taken all the iron that you took for the 9 months was basically you providing good nutrition to your baby. Now the next 3 months, or the fourth trimester that we like to call it, is for yourself. So you have to continue with your iron, calcium and protein supplementation, which 80% women stop because they get so busy with their babies and they're like, okay, now the food is getting neglected, the sleep is getting neglected. That is not in our control. The sleep is going to suffer a bit. But what is in our control is taking those 2-3 medicines now. Don't stop that. Yeah.
So as it is, the body goes through a lot of stress during pregnancy. Giving birth to a baby is stress for the body. You've lost blood, you've given birth to the baby, the nutrition has been majorly. Body has a beautiful way of concentrating on what it needs at that moment the best. At here, it is your baby. So everything is going to the baby. And then, like she rightly said, the minute pregnancy is done, you think that's pregnancy supplement, so I'm going to stop it. And because of the stress, also stress doesn't mean that today you're stressed and today hair is going to fall. It's going to take the toothache. There's an old wife's myth or tale that they say, baby smiled and my hair started falling.
Yes, I've heard of
You've
that
heard
one.
of that, right? So that is only to define that it takes 3 months for the baby to recognize, make eye contact and smile. So when 3 or whatever months, I don't know, I might be quoting it wrong. So it takes some amount of time. So that amount of time, your now body has processed the stress, and the hair, which was in a beautiful growing phase because it was supported by growth hormones. Your pregnancy hair, have you seen? It feels lush
Yes.
and dark and beautiful and shining because all the hormones are also supporting it and the nutrition. Now all that is suddenly all your growth hormones and supporting hormones towards growth is suddenly gone. And then your prolactin is increasing, which is also a slightly inflammatory hormone towards yourself. So your hair starts to fall, stress has made your hair fall, and your nutrition lack makes your hair fall. So please take specific supplements from then onwards. What I love giving for my patients, of course, is the raw anagen, which is our most bestseller. They love it and they start taking that. So that's something which is very nice. I also like to put them on defense to reduce the inflammation and maybe cut down oxidative stress also, because there's so much extra oxidative stress happening there. So this is what I end up giving.